So here's the robot,
Right,
and that's Harry.
Hi, Harry. Sanjeev. Sanjeev. Hi. Hi.
So
All of this is all.
yeah. So that's where the patient sits,
Yeah.
and that's the head of the robot that's got normally the punch or the needle attached to it. And normally what we do, position the patient, then the robot arm or the head comes around, and we put like a grid on the patient's head that has digital markings that the robot recognizes, because there are cameras inside that head. So it recognizes it, reads the digital readings, and it starts mapping out the hairs, and it shoots into automated mode, if you like, and we can monitor the action on screen. And if all being well, it does its own thing. Otherwise, we can I hold this controller here, and I can make adjustments if I think anything needs adjusting. And
Well, presumably, I mean, this kind of mobility scooter thing that you have here. Presumably, this is where the person sits.
Yeah,
and they kind of face forward.
Yeah. As a matter of fact, why don't you try it out?
You did say there are no needles.
No transplants today. Yeah.
All right. So, okay, so one sits.
Whoa.
Whoa, you see?
Okay.
Has this got brakes?
Yeah. It does have brakes. Yeah.
Have you got a license?
Yeah.
I mean, do I need a license? Okay.
Yeah.
So one would sit like this, okay,
Yeah.
and then.
So we'll put the brake on just so that you get the full experience.
Exactly.
There we go.
So presumably you put your face here, I guess.
That's right. Kind of so well, there's a variety of positions. So you can either have your face down in like a massage chair type thing, when we take the hairs from the back of your head, but we also can put your head to one side or the other if removing hairs from the side. I'll show you. For example, this pillow here.
All right.
Side. So you put your chest here and you put your face that way.
Oh, facing.
There,
okay.
Yeah,
oh,
that's right. Yeah, and then what we do is we fit this grid I was talking about on the head, and the straps. It has straps that fit right in there so that you feel snug in position.
So your head really mustn't move at all, was it?
Yeah, that's right. You're not supposed to move your head, and and the grid also has readings for the robot to know which is the spot that needs to remove hairs from.
Right.
And once it identifies that has a very fast camera system in it. It makes all sorts of calculations to figure out direction, angles, numbers of hairs, and the whole thing is automated. But I monitor it on screen, and if I think it needs any adjustments, I use this piece to make adjustments as I go along, or not.
Yeah.
And that's it. And we usually go on for about an hour, 2 hours, take stock, put them back in your head, give you a break, and then come back here and maybe do another hour or two of what we call harvesting of the hairs. Yeah, I can actually show you. If you like, when your head is down, you can sense what the patient's hearing when they're moving. Yeah, put your face there, and we'll get Harry to move the head with the nose.
All right. Oh, good. I can
Harry,
see it now.
Action it.
Oh, hello. What are you doing, Dave? Don't open the airlock, Dave.
Yeah, that goes back a long way. Yeah. Was that from 2001?
It was.
Yeah.
Oh, well done.
So the noise is very. I mean, when it actually does work and starts punching, it does sound like a clicking noise. But you don't feel anything at all because the head is anaesthetized.
I mean, this wasn't around when I first came in.
We've had it now just over 2 years. Well, actually, not even 2 years. It'll be 2 years in August. So it's a pretty brand new machine. It's only been on the market since 2011 in the States.
Right.
And there's probably about 100 of them around the world. There's 2 of them in the UK, and there's maybe 10 or so in Europe, and the rest of them are in the States or in the Far East.
Wow,
so it's not that many of them.
Not many at all.
No,
so there's only 2 in the UK.
There's only 2 in the UK, yeah, and one of them is here.
And one of them's here. I'm sitting right here with it. Wow.
So yeah, it's a rare sight in the UK.